Welcome to the Ryan White Planning Council's first public hearing for 2021. In keeping with the best practices for social distancing to slow the spread of COVID-19, the public hearing was pre-recorded online through Zoom. If you would like a copy of the information being presented this evening, you can view and download the documents from our website at rwpchouston.org. My name is Rosalind Belcher, and I am one of the co-chairs of the Affected Community Committee of the Ryan White Planning Council. Also with us this evening is my co-chair, Tony Crawford, the chair of the Ryan White Planning Council, Alan Murray, the co-chairs of the Quality Improvement Committee, Stephen Vargas and Kevin Aloysius, and Tori Williams, liaison to County Judge Lena Hidalgo. The focus of tonight's public hearing is the recommended changes to the services funded by Ryan White Part A, Part B, and state services for fiscal year 2022, which will begin on March 1st, 2022. But first, there will be a presentation on the Project LEAP by Tori Williams, who is one of the facilitators of the program. Afterwards, Stephen will explain the Quality Improvement Committee's how to best meet the need process, and then Kevin will present the committee's recommendations for HIV medical and support services funded by Ryan White that are currently provided in Harris County and the surrounding areas. Remember that everything discussed here will not affect how services are delivered now, but will impact how services are delivered approximately 10 months from now in the year 2022. After the presentations, you will learn how you can give public comment regarding the information presented. At this time, I would like to turn the meeting over to the chair of the Ryan White Planning Council, Alan Murray, who will describe the role of the Planning Council and the purpose of this public hearing.
Thank you, Rosalind. Good evening, everyone, and welcome. I would like to briefly describe the history of the Planning Council, what it is that we do, and why we are here tonight. The Ryan White program is the largest federal program focused exclusively on HIV care for those who do not have sufficient health care coverage or financial resources for meeting the challenges of HIV disease. Ryan White fills the gaps in care that are not covered by other services. The federal legislation is known as the Ryan White HIV/AIDS Treatment Extension Act of 2009. It was enacted in 1990 as the Ryan White Care Act and has been amended and reauthorized 4 times in 1996, in 2000, 2006, and 2009. Adjusting with each reauthorization to accommodate new and emerging needs, such as increased emphasis on providing life-saving and life-extending medical services for people living with HIV. The Ryan White program works with cities, states, and local community-based organizations to provide HIV-related services to more than 500,000 people each year. There are several parts within the Ryan White program, each one designed to meet the needs of different communities and populations affected by HIV. Part A funds are designed to serve metropolitan areas and are awarded to the chief elected official primarily responsible for providing health care in the geographic area. In Houston, eligible metropolitan area, that person is County Judge Lena Hidalgo. In 2020, Harris County received over $24 million to provide HIV services for people with HIV throughout the 6-county area, namely Harris, Fort Bend, Waller, Liberty, Chambers, and Montgomery counties. Part B funds are awarded directly to the state of Texas and are used to provide care for people with HIV in a 10-county area, which includes the 6 counties named previously in Austin, Colorado, Walker, and Wharton counties. In 2007, the state asked the Houston Ryan White Planning Council to make recommendations for Part B in state service funds. In fiscal year 2020, Ryan White Part A, Part B, and state service dollars totaled over $30 million. Again, Congress requires that most of these funds be used to provide medical services for people living with HIV in the 10-county area. Currently, approximately 15,000 individuals out of 30,000 people living with HIV in our area are using Ryan White funded services. By law, the council is charged with determining the number of individuals in our area who are living with HIV, assisting the needs of the HIV community, establishing a comprehensive services plan, setting service priorities and allocating funds, assuring that there are sufficient services to meet the future needs of the changing epidemic, assuring that appropriate services are available to meet the needs of the unserved, underserved, women, infants, children, and youth, ensuring access to services for those who have substance abuse treatment needs, and assisting the administrative mechanism which procures services and distributes funds. The Planning Council falls under the Texas Open Meetings Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community and take public comment and input very seriously. The council is currently meeting virtually on the second Thursday of every month at noon. For more information, the phone number is 832-927-7926, or you can visit us on the web at rwpchouston.org. This information will be repeated for you at the end of the program. It is important to remember that Ryan White funds are the funds of last resort. This means that all other resources for an individual must be exhausted or unavailable before Ryan White funds can be used. For example, a person must use their private insurance, Medicaid or Medicare benefits before they are eligible to have Ryan White monies pay for primary medical care. There are also income eligibility requirements that govern the use of Ryan White funds. Many of the services that we provide have an income cap of 300% of the poverty level guidelines, which means that an individual with a yearly income of $38,640 or less would be eligible for assistance, provided all other avenues of coverage have been exhausted. The same guidelines applied to a single parent with one child would be $52,260 or less. The service categories to be reviewed this evening includes those that are funded by Ryan White Part A, Part B, and state services. Examples of some of the services which the Ryan White Planning Program funds are allowed to provide include outpatient primary medical care, medications, dental, mental health services, and assistance to pay health insurance premium, copays, and deductibles. The purpose of tonight's program is to inform the public of recommended changes to the local service category definitions in order to get feedback from consumers of the Ryan White funded services and others as to how the recommended changes will affect their ability to receive medical care and support services. Community input is not only necessary, it is vital to all the Planning Council's processes and is encouraged at every level. At this time, I would like to introduce our next speaker, Tori Williams, director of the Office of the Support, who will present information about the Planning Council's training program, Project LEAP.
Thank you, Alan. I want to talk to you about an educational opportunity for people who want to learn about the HIV prevention and care system in the greater Houston area. The name of the program is Project LEAP, which stands for Learning, Empowerment, Advocacy, and Participation. Project LEAP is for people living with or affected by HIV. Classes start in July and the program is free, but the expectation is that students participate in one class a week for 17 weeks, and they come to class prepared to listen and engage with the presenters and with one another. Project LEAP is unique to Houston and is only offered to 30 students once a year. The goal of the program is to provide skills so that graduates use these skills to become active and effective participants in local HIV planning groups, such as the Ryan White Planning Council or the Houston HIV Prevention Community Planning Group, or otherwise known as CPG. Graduates help shape the future of HIV services in our community. Project LEAP was created because local planning groups need people living with HIV and others who are not afraid to speak up and advocate for the needs of consumers. After graduation, students feel more knowledgeable and confident as they work with doctors, nurses, and other healthcare workers to design services. If you are a person living with HIV, or you have a friend or a family member that is challenged by HIV, you are a perfect candidate for this class. How does Project LEAP work? Classes are held on Wednesdays for 17 weeks. 15 students participate in the morning class and 15 different students participate in the evening class. Classes are 4 hours in length and include hands-on activities, group projects, and field trips. Guest speakers are experts in their field and enjoy sharing new and updated information with the students. As you can see from the long list on the screen, some of the topics covered in the class include HIV 101, the history of HIV in the Houston area, tools for designing services, local HIV trends for special populations, and much more. Skills include meeting facilitation and Robert's Rules of Order. If you don't know what that is, we will teach you. You will also learn presentation skills, how to read and understand data, planning and evaluation skills, advocacy, and cultural competency. The facilitators provide information and handouts for each class. We have mock meetings, bring in expert speakers, and there are hands-on activities. As I said, class projects and several field trips to see what planning groups do when they meet. Those eligible to apply for Project LEAP are people who are living with HIV or are affected by HIV personally or professionally, and people who can meet the class expectations in terms of attendance and participation. What do you get out of Project LEAP? You get knowledge and skills that will help you advocate for your health and the health of others. You get access to experts and mentors, an extensive binder of information and materials about HIV. You will be part of a learning community of people who share your passion and concern for the issue. And most important of all, you will get the opportunity to make a difference. So how can you apply to be a Project LEAP student? You must submit a written application before July 2nd. We will call and set up a virtual interview. And if you don't have a computer or internet access, call us and we will make other arrangements. Classes will begin on July 28th and end in mid-November. To find out more information or to apply, you have 3 ways to reach us. 1, go to our website at rwpchouston.org or call 832-927-7926. Or you can email us at diane.beck@cjo.hctx.net, and Diane will get back to you. This contact information will be repeated at the end of the public hearing. Thank you, and we hope to hear from you soon. The next speaker is Stephen Vargas, the co-chair of the Quality Improvement Committee.
Thank you, Tori. Thank you. Just so everyone knows, many of the current and former council members are graduates of Project LEAP, and I think all of us would agree that the training is really valuable for those who want to be involved in the planning process. So I highly encourage anyone who wants to be part of this process to apply for Project LEAP this year. Yeah, join us. The how to best meet the need process is a little bit of what I'm going to talk about now. It's what we do every year to hear from the community about what is working, what's not working, and particularly any kind of recommendations both folks who provide services and folks living with HIV have to make to the council. We've just completed that, and that is going to be the focus of tonight's public hearing. Each of the Part A, Part B, and Texas Department of State Health Services funded service categories was reviewed during a series of work groups comprised of consumers, people living with HIV, service providers, the healthcare providers, and other community members. The work groups made recommendations for each of the local service definitions, and the Quality Improvement Committee met to review and approve those recommendations. All the comments received from the community regarding the recommendations will be forwarded to the Quality Improvement Committee for consideration after this public hearing is aired, and added to the recommendations that'll go to the Planning Council for final approval next month. So a copy of all the service definitions, including recommendations from the work groups and Quality Improvement Committee, is available in the information packet, which can be located on the website, www.rwpchouston.org. I'd also like to mention our use of the federal poverty guidelines as eligibility criteria for the Ryan White services. These guidelines are evaluated annually during the How to Best Meet the Need process. For most services, the financial eligibility is set at 300% of the federal poverty level. The federal poverty guidelines for 2021, you can see them up on the screen now. For a single person, 300% of the federal poverty level is an annual income at or below $38,640. For a family of 2, 300% of the federal poverty level is $52,260. And for a family of 3, 300% of the federal poverty level is $65,880. For each additional family member, one would just add $5,680 to that amount. The same increment applies to smaller family sizes, as can be seen in the previous figures. According to the U.S. Department of Health and Human Services, their webpage, where the guidelines are located, they become effective on the day they are published. A copy of the 2021 Federal Poverty Guidelines is included in that information packet, which you spoke about earlier. And so now, at this time, on my co-chair, I'm going to go and pass it to my co-chair, Kevin Aloysius, who's going to present the recommendations and describe the changes to the service definitions for the fiscal year 2022. Please note that the services discussed are for people who are living with HIV and meet the required eligibility guidelines. Kevin.
Thank you, Stephen. I will now present the recommended changes to the service definitions and eligibility guidelines for fiscal year 2022. The information packet for tonight's public hearing includes a copy of each of the service definitions, along with a summary list of the recommended changes for each service category. The current financial eligibility for each service, as well as the suggested financial eligibility for fiscal year 2022, is listed on the table of contents of the service definition packet. First, I will present the list of services for which no changes to the service definition or financial eligibility are recommended. Ambulatory outpatient medical care, which includes medical case management, local pharmacy assistance, emergency financial assistance, pharmacy assistance, outreach, and service linkage. Case management, including clinical, non-medical service linkage, and non-medical targeting substance use disorders. Early intervention services targeting the incarcerated. Health insurance premium and cost sharing assistance. Hospice services. Linguistic services. Medical nutritional therapy and supplements. Oral health, untargeted and targeting the northern rural area. And medical transportation. The Quality Improvement Committee approved the How to Best Meet the Need workgroup recommendations for the following services. Emergency Financial Assistance Other. Note, this is a new service that started March 1, 2021. Accept the service definition as presented and keep the financial eligibility the same. Ask the Office of Support to highlight the service in Road to Success and ask the administrative agents to actively promote the service. Home and community-based health services, locally known as adult day treatment. Accept the service definition as presented and increase the financial eligibility from 300 to 400% of the federal poverty level. Also, ask the Office of Support to highlight the service in Road to Success and ask the administrative agents to actively promote the service. Mental health services. Accept the service definition as presented and increase the financial eligibility from 400 to 500% of the federal poverty level. Referral for healthcare and support services, locally known as ADAP enrollment workers. Accept the service definition as presented and increase the financial eligibility from 300 to 500% of the federal poverty level to be in line with the eligibility for HIV medications in the local pharmacy assistance program. Outpatient substance abuse treatment. Accept the service definition as presented and increase the financial eligibility from 300 to 500% of the federal poverty level. Also ask the Office of Support to highlight the service in Road to Success. Vision care. Accept the service definition as presented and increase the financial eligibility from 300 to 400% of the federal poverty level. For more information about these suggested changes, please contact the Office of Support at 832-927-7926. I will now turn the floor over to the co-chair of the Affected Community Committee, Tony Crawford, who will explain the process for submitting public comment regarding the information presented at tonight's public hearing.
After hearing information presented this evening, you may want to give public comment and planning council. Starting over. Again, Kevin, thank you. And special thanks to the Quality Improvement Committee and how to best meet needs of workshop participants for the hard work they've done to put into the important process. After hearing the information presented this evening, you may give public comment to the Planning Council. Planning Council falls under the Texas Open Meeting Act, and its processes are open to the public at all levels. We strongly encourage participation by all members of the community to take public comment, and we take the input very seriously. There are several options for you to provide public comment to the Planning Council, and we are not required to give your name or your HIV status. You can email your comments to feedback@htcx.net. You can fax your comments to 713-572-3740. You can also call in your comments at 927-7926. You can send your comments through our Facebook page at RWPC Houston. Comments must be received by before noon on June the 1st. That's Tuesday. Comments will be forwarded to the Quality Improvement Committee for review and consideration. If significant public comments related to the service categories are received, the Quality Improvement Committee will meet via Zoom on June 2nd to review the comments and consider making the changes to the recommended service definitions. On June 3rd and June 10th, the Steering Committee and Planning Council will review and vote on the fiscal year 2022 service definitions. You're welcome to attend any of these meetings virtually. Check on our website and calendar for the instructions on how to participate by Zoom. Well, this concludes the first Ryan White Planning Committee Public Hearing 2021. I would like to thank everyone who viewed the program, participating in its important process. As stated earlier, the service category recommendations presented will not affect the services and are delivered now, but they will impact the services delivered approximately 10 months from now, on the year 2022. The Ryan White Planning Committee Council meets on the second Thursday of every month at noon. Please check your calendars on the website at rwpchouston.org for the location of the meeting, as they are currently being held virtually on Zoom. Do not come to the office without calling to be sure that we are open to visitors. To apply for Project Relief, the free training program, which looks at the HIV prevention and care system in the greater Houston area, please go to our website at rwpchouston.org for a link to submit it online. This is your application, and the applications are due on July the 2nd. This is a wonderful learning experience, and I encourage anyone interested in HIV services to apply. Our next public hearing will be at 7 p.m. on Monday, June 28th. The topics to be presented will include priority and allocations committees, recommendations for the service category priority ranking and funding of allocations for the fiscal year 2022. On behalf of Ryan White Planning Council, we thank you again for participating and have a good evening.